How do I lose a double chin? So there's a number of different treatments that address the double chin, or this area right here. There is CoolSculpting, where you basically freeze the fat. There is Kybella, where you rupture the fat cells. There is surgery, where we do liposuction. And then there is surgery where we take the deeper layer of the fat on the neck. And it depends on what is going on with you, of what is going to be better. And this is something we can determine in an exam whenever you come in for a consult, is where that fat is. So there's the skin, and then there's fat that can be underneath the skin. Then there's a layer of muscle called the platysma. It's a thin layer that runs right here. And then there's fat that can be underneath that platysma. If you have fat that's underneath the skin and above that platysma, that is much easier to treat. So you can do things like CoolSculpting, you can do Kybella if that's what you choose, and then you can do liposuction. I think liposuction works the best. You get the best result, the least downtime, and it's the most reproducible. Can I get CoolSculpting for a double chin? Yes, you can use CoolSculpting. The way this works is it freezes that area, and fat freezes at a higher temperature than the skin. And so the skin will say safe because you don't get down to that temperature, but the fat will go away. And then your body just clears that out just like it would swelling from anything else. This can take a couple of sessions, and you can have things like numbness or some discomfort after those treatments. It's hard to say that you will get 100% resolution of that fat because it is also hard to control what fat goes away and what fat stays. Can I have surgery for a double chin? Yes, absolutely. I think this is the best way to address a double chin. If you have fat in that pre-platysmal space, meaning between the skin and the platysma, you can do liposuction, and that's something that's simple that you can do in the office, and you can get a really, really good result. If you have fat that's between that platysma or underneath that platysma, that is a little bit more involved surgery, but it can be done to get you a really nice defined jawline. For the downtime of those, it's really not that much. It's about 1 to 2 weeks, and the discomfort is minimal. Why do I have a double chin if I'm skinny? Because this is something that's genetic, unfortunately. People will gain and lose weight, and some people will gain weight here, but it's to a much smaller degree that we have fluctuations under the chin than we do in the rest of our body. It's just a genetic area, particularly if it's subplatysmal. And so losing weight does help, but it may not make it completely go away, and so that might be something you would look at doing some sort of procedure later once you get at your ideal weight. Have questions? I help people like you every day and would love to help you as well. Give us a call.